Welcome to the Explainer. Every single thing you do, from running a marathon to just clicking to watch this, is all powered by this incredible biological machine. So today, we are going to pull back the curtain on that machine, your musculoskeletal system.
Think about it. It's a simple thought, right? And then, bam, action. But behind that one tiny little movement, there's this silent symphony of bones, muscles, and nerves all working in perfect harmony. So let's break down that symphony piece by piece.
All right, so here's our game plan. First, we'll meet the major players in the system that moves you. Then, we're going to see how muscles actually make a move. After that, we'll look at the body's living framework. Then, we'll explore what happens when the system breaks. And finally, how it heals and how we can get help. All right, Section 1, the system that moves you. We're going to introduce the major players. So yeah, let's dive right in and meet the core components that are responsible for, well, every single move you make.
It really all boils down to this power trio. First, you've got the bones. That's your structural frame, giving you shape. Then you've got the muscles, which are like these incredible engines creating force. And finally, the joints, which are the hinges where the bones meet. And they're what allow for all that motion. Seriously, take away any one of these and we'd all just be statues.
Okay, but here's the thing. Not all muscle is the same. Your heart has its own special type, cardiac muscle, and your organs use what's called smooth muscle. Both of those, they work completely on their own without you even thinking about it. But for today, we're going to focus on the one you're actively using right now, skeletal muscle. That's the only type that's under your complete conscious control. Okay, Section 2, how muscles make a move. We're taking a microscopic look at a mighty action. So how exactly does a thought in your brain translate into your bicep actually bulging to lift that cup? Well, the answer isn't just small, it's microscopic. Let's zoom way, way in. So deep inside every single one of your muscle fibers, there are literally millions upon millions of these tiny little engines called sarcomeres. This is it. This is the absolute ground floor, the fundamental unit where the real magic of muscle contraction actually happens.
And it's this incredibly precise 5-step chemical chain reaction. First, a signal arrives from a nerve. That signal causes a release of calcium ions right into the muscle cell. Then, that calcium binds to a protein. This binding action uncovers the important sites on another filament. And finally, boom, another protein latches on and pulls, shortening the whole muscle. Imagine millions of these things happening at once. That's a muscle contraction.
And here they are. Meet the two stars of that microscopic show. You've got the thin actin filament. You can think of that as a long, thin rope. And then you have the thick myosin filament. That's the motor with these little heads that do all the pulling. It's kind of wild, but every single movement you make is basically just billions of these myosin heads grabbing and yanking on those actin ropes. Section 3 is all about the body's living framework, because it's more than just a skeleton. All that pulling we just talked about, it needs something to pull on, right? So let's look at the incredible framework our muscles are attached to, our bones. And trust me, they are so much more than just a dry, static scaffold. Yeah, our bones are the ultimate multitaskers. Sure, they give us a framework and support our tissues, they protect our organs, and they help us move. But they're also a living bank for minerals like calcium. And hidden deep inside the marrow, they are these tireless little factories just churning out our blood cells. It's amazing. And the reason our bones are so dynamic, it all comes down to this constant teamwork between two types of cells. You've got the osteoblasts, those are the builders, constantly laying down new bone tissue. And then you have the osteoclasts, the breakers, and their job is to clear away the old stuff. This endless cycle of renewal is exactly how our skeletons repair themselves and adapt throughout our entire lives.
206. That's the number. That's how many bones are in a typical adult skeleton. But here's a fun little fact for you. You were actually born with around 300. What happens is, as we grow up, a lot of those smaller bones fuse together to form the stronger, larger bones we have as adults. Pretty cool, huh?
All right, Section 4, when the system breaks, we're talking trauma and injury. Going from 300 bones down to 206, it's obviously a very strong adaptive system. But it isn't invincible. So what happens when it gets pushed beyond its limits? Let's talk about what happens when things go wrong. Okay, I think we've all been confused by this at some point. What's the difference between a sprain and a strain? Well, the difference is actually pretty simple. A strain is a tear in a tendon or muscle. A sprain, on the other hand, is a tear in a ligament. That's it. One is muscle or tendon, the other is ligament. But what happens when the force is just too great for the bone itself? Well, then you get this. A break in the integrity of bone tissue. That's the clinical definition of a fracture. It's a pretty simple definition for what can be a really painful and complex injury. And believe me, not all fractures are the same. They can range from just a simple hairline crack to something way more serious, like what you're seeing here. This is a comminuted fracture, and that's where the bone actually shatters into several fragments, usually from a pretty direct, forceful impact.
Okay, Section 5, Healing and Getting Help. The body's blueprint for repair. Now, a broken bone might seem, well, catastrophic. But one of the most remarkable things about this entire system is its incredible built-in ability to heal itself. And bone healing, it's a long and pretty fascinating journey. It starts literally within days, with a hematoma, basically bleeding and clotting at the break. Then, within a couple of weeks, new tissue starts to form. Over the next 2 to 3 months, the body builds this soft callus of immature bone to stabilize things. That hardens over the next couple of years, and then, and this is the wild part, over 3 or more years, the bone is remodeled back to its original shape by those osteoclast breaker cells we met earlier. Amazing.
So, while the body is doing its thing, what can we do to help, especially after a less severe injury, like a sprain or strain? Well, just remember the simple acronym RICE. R is for rest, to prevent more injury. I is for ice, apply it for about 20 minutes to reduce swelling. C is for compression, which also helps with swelling. And E is for elevation, raising the limb to help with pressure. RICE. Simple, but effective. Now, for more serious fractures, of course, modern medicine can lend a really powerful hand. Things like casts, traction, and even surgery, they all help to immobilize and realign the bone. They basically give it the perfect, stable environment it needs to heal correctly. So we've seen the molecular motors, the living framework, and the amazing capacity for repair that powers our every move. When you think about it, this incredible system carries you through life, silently, every single second of every day. So that leaves us with one final thought. Knowing all the complexity inside, how can you better support the incredible system that carries you through life every day?